Hi, everybody. My name is Bradley Heacock, and I did my internship at Institute for Precision and Movement, which is a physical therapy clinic in Redlands, California. You can find the link to my completed project poster in the description down below. This poster contains the information that I will be summarizing in this video. My internship supervisor was Dr. Peter Lingus, and we decided the project title should be Manual Therapy Technique IASTM. So let's get into it. You may be asking, what is IASTM? Well, IASTM stands for Instrument Assisted Soft Tissue Mobilization. It is a manual therapy technique where the provider uses handheld instruments to break down scar tissue and adhesions within soft muscle tissues. This increases the amount of blood flow to the treated soft tissue, which in turn influences physiological recovery processes to take place. Throughout my internship experience, my supervisor educated me on IASTM and the type of conditions it may benefit, which are tendinopathies, muscle strains, limited range of motion, or patients who are rehabilitating from injury. I was able to observe a variety of patients being treated with IASTM, such as patients with tendinitis, forearm and calf tightness, which is relative soft muscle tissue tightness, and patients who were rehabbing from specifically knee injuries. It is also commonly used on back muscles to relieve tightness and adhesions, but I did really not really observe this during my clinical experience. I learned the methods that Dr. Lingus uses to administer the therapy, which are palpating targeted tissues for adhesions, then applying about 2 to 3 pounds of pressure for around 2 minutes on the targeted soft tissue. The results I observed in clinic were patients reporting decreased pain levels, patients reporting decreased feelings of muscle tightness. We observed an increase in range of motion post-treatment within those muscle tissues, and the patient's skin may actually show redness or it's called petechiae on the surface of the skin due to blood vessels being broken down by the muscle scraping technique. I was able to gain hands-on experience actually practicing IASTM in the clinical setting. One example would be when I administered the technique to a patient's patella tendon. Their patella tendon was tight, coming back from an injury, and so the surrounding areas around that were very inflamed, causing the knee joint to be immobile. And so we were trying to, induce blood flow to the injured area, the affected area, and increase that range of motion post-treatment. So I used the hand tool along with lotion on the skin for lubrication. Then I applied about 2 pounds of pressure while scraping in the same direction as the muscle fibers. So you go with the muscle fibers, you can go against them, but it was really common, and especially with my supervisor, I almost always saw they would go with the grain of the fibers. I began to feel different amounts of tension in different parts of the treated area. And it was very interesting because I was able to feel the tension almost like dissolve away as I continued to scrape over the adhesions. Their skin began to show slight redness by the end of the scraping, which is normal, and I was feeling less tension under the tool by the time I was done. This patient actually reported to me that they felt it was a little looser and they were actually able to improve their range of motion slightly. So this project provided me with an opportunity to learn and practice a manual therapy technique related to the field of physical therapy. Overall, I learned how instrument-assisted soft tissue mobilization is a myofascial release technique that has clinical benefits for pain, range of motion, muscle function, and even muscle recovery. As a future provider, this project had a positive impact on my education about one of the many manual therapy techniques, and I honestly look forward to gaining more experience in the field of physical therapy and potentially learning more of the many manual therapy techniques. Undergraduate classes that helped prepare me for this project were Anatomy and Physiology Parts 1 and 2, Applied Anatomy, Athletic Therapy, and Exercise Physiology. These courses applied to my project because they taught me muscle anatomy, such as different muscles and their locations within the body, taught me the importance of blood flow to muscles for recovery and healing processes because blood delivers oxygen and nutrients to muscles, and taught me common myofascial trigger point locations that IASTM may be applied to because IASTM focuses on soft muscle tissue. I enjoyed the entirety of my internship experience, and I really look forward to pursuing the field of physical therapy. If anyone has any questions or comments, please leave them down below and I'll get back to you as soon as I can. Thank you so much for listening.